Namaste. Myself, Dr. Gaurav Chawda, behalf of MADHUDEEP IVF and Test Tube Baby Hospital, I once again warm welcome you. Today's topic is worth to watch for every infertile couple. We are a IVF consultant and not a Tom, Dick or Harry. And you are a responsible couple and not a scapegoat. So that is the basic thing to understand this video. So let's start. As you know, in some place they make poem and show and tell we help you to creating a child in you, even in cases of tubal blockage. So let's understand what is the tubal blockage. To understand tubal blockage, you have to first understand what is normal anatomy of the genital or reproductive tract. So let's start. Please magnify this specimen. Here is a uterus. This is the endometrial cavity where we put an embryo. This cervical canal. This is a cervix and this is vagina. This both sides there is a long tube elevation is known as a fallopian tube or tube and both ovaries. In normal cases, when this ovulation happens, egg is grasped by this end of the fallopian tube and from there is traveled to the infundibulum where injected sperm is contact here with the ovum and is pregnancy is developed or fertilize the egg, then embryo is once again traveled back to the uterine cavity and is implanted. This whole procedure is happening in normal cases. In case of pathology of the tube, this normal process can't happen, so leads to the infertility. Now, what are the causes of the tubal pathology? To understand this, we have to know the causes. First cause is tubal ligation because for family welfare operation. Second is the hydrosalpinx. Third is the pyosalpinx. Fourth one, obtuse of the tube. In some cases, secondarily to the PID, primary inflammatory disease, leukorrhea, and genital TB, they are the known causes. Or in rare cases, there may be congenital absence of the tube is also present. Tube may be one-sided block or both-sided block. These are the common cause. When you reach to the consultant doctor, they consult you and advise for the HSG, which is known as a hysterosalpingography or maybe a sonosalpingography, in which a plate of the uterus is created on the X-ray and then decided it tube is patent or not. In that cases, there may be a semi-filling or absent of filling of the dye is present in the this X-ray. Now, what are the treatment modalities? If there is no hydrosalpinx or TO mass, doctor can advise you for the laparotomy or laparoscopy. In these cases, tubal recognition is available, but most of cases this surgery is failed, and there may be chances of after surgery there may be ectopic pregnancy is a life-threatening and emergency condition. So to avoid it, IVF or test tube baby is the gold standard 100% pure gold method for the conceiving or getting the child. So this whole regarding what is the indication, what are the cause and how we treat this condition. In some cases, in tubal blockage of unilateral or bilateral, patient always asks, if I have one or both tube block, is there any complication after conceiving with the help of IVF? To understand that, we have to first understand the basic thing that when we advise or we are going on the procedure of IVF, at that time we give the injection to the patient, so egg is making a proper way then we pick up the egg, then we use the sperm of our husband, make an embryo, and we transfer inside the uterine cavity. So we bypass this both tube, so there is no any complication or any problem regarding the tubal blockage in IVF. So that is the whole thing of this whole procedure. So don't procrastinating this condition. Also, don't feel remorse or repent regarding these conditions. So let's start a journey toward getting parenthood. If you have any problem of such type of diseases, you can contact MADHUDEEP IVF and Test Tube Baby Hospital. Our address is MADHUDEEP IVF and Test Tube Baby Hospital, Panwadi Chowk, opposite Pill Garden, near ST Bus Stand, Bhavnagar. Our mobile number is 97148 64644. Jai Hind, Jai Bharat, Vande Mataram. Namaskar.